I'm going to be streaming here on YouTube too, where you'll be able to see 2 streams with my book and the questions, maybe a little bit easier. So just in case anybody wanted to, you could watch this live on YouTube also. So it is streaming now, I hope, on YouTube too, if I got this figured out. I'm trying to get things to where I'm not showing you a picture of a picture through a screen and things won't be shaky, that you just can see my desktop. Like this is a Word document, and then this is a teaching camera that is turning a book into a PDF, and it won't shake. So I don't know. I get a lot of complaints about that stuff is blurry, they can't make it out. So that's what I'm trying to do for 2021. I had my son in here helping me out last night. We were working on that. And so the YouTube replays won't be of TikToks. They'll be their own entity made inside YouTube from an OBS, whatever. So I don't know. I don't know what I'm doing, but hopefully this will look a little better as far as the replays go, for sure. How's everybody's Monday going? My kids are still home from school. Oh yeah, I can't tell. Oh yeah, I probably got to bring this camera down too for the YouTube people. Or the microphone. Let me see on this microphone. Am I doing the UBS? I got to be in the orange, my son says, for the mic to be working. Y'all should see it. I got this mic in front of my face now too, so it's all crazy. Looks legit. But anyway. Oh no, Vivi has COVID. My sister from another mother and father. My sister has COVID right now too. She first had influenza A, and now she's got COVID. She missed Christmas and the New Year's with us. Hey, Shug, I'm doing great. I'm trying to learn some new things. Hey, Go-Kart. Definitely live on both. Isn't that crazy? It's hard for me to tell what it looks like from this end because I need to get dual screens so I can tell what you guys can see. But let me see. Can I go to YouTube? YouTube 2 on my cell phone and have it up. Oh yeah, I forgot about Travis's medicine. It is available for pickup. Let's see. There's my channel. There's the live little button. Oh yeah. Oh yeah, I forgot about Travis's medicine. It's on a little bit of a delay from TikTok, so that's kind of cool. But this is what it looks like. Oops, if I can get my camera in here. On YouTube, you have a dual screen. There's 2 screens. You can see the question and then you can see my book. So it's kind of cool, I hope. And hopefully it won't be blurry. It'll be super crisp, I guess. I hope is my intention anyway. I'm trying to make these better. Hey Maggie, how's it going? Hey Baking, good to see you. Hey Because. Hey Cece. Hey Sass, how's it going? Hope you get to feeling better fast. You think it sounds much better? That's awesome. That's good. Yeah, he made me. My sister got me a camera for my birthday, or not a camera, but a microphone for my birthday in April, and I never did utilize it yet. So it's like, okay, it's time. First live of 2023. That's right. Is that Charisse? That's awesome. Hey, Sass. Hey, Island Mountain Nurse. Good to see you. My night's been okay. I've been skipping around from one subject to another. There's so many projects I want to get done. I was working on some definitions for the CPMA, and then was also working on some 2023 E&M stuff. I'm also thinking about our workshop we want to have on, what day is that? The 15th. And I see this whole glass thing my son got me. It's a glass. It's huge. It's massive. And I can write down all of our dates on it and who gets what days I'm doing tutoring. But this is really cool. So that's up there. This is the camera and jargon we have all set up. But we've got a workshop we want to do on the 15th of January, and I want to go through the entire CPC exam, what you can expect from or should know from each chapter, top highlights of what to have marked, what's the differences, what's the one thing you should go through that chapter and mark those differences or do this. And I also want to do a couple of the hardest questions from each chapter. I'm going to try to get through all 17 measures in the medical coding certification exam. We might run a little long, like 4 hours, but hopefully I can get it all done into one workshop on that Sunday. So it's up and available if anybody wants to join in. And then I'm also creating material for Friday for my repeat exam takers that need extra bonus questions just to practice with. Those classes are $5 on Fridays. We usually run a couple of hours, and it's just back-to-back tough practice questions. Questions more guideline related, sequencing guideline related, stuff that you would probably run into on the exam. So hopefully that's helpful. And that is up for this Friday. Happy New Year. Yes, yes, yes. So my night BS is going crazy. I keep going from one end to the other. Mountain Nurse booked a class. Awesome. I have tutoring with somebody tomorrow. It's a new somebody. Let's see. Who is that tomorrow? LaTanya. So I have her tutoring in the morning. Let's see. Since I am on TicTok app on a laptop, I can log on to YouTube too. It's crazy, but yes, it's looking good. Awesome. Awesome, awesome, awesome. That's cool. I know it's strange, but hopefully it's looking better. We'll see. I love the new look and the new sound. Aw, awesome. Hey, Jen. Good to see you. You won something the last time I did a live. I did post Friday's live up on YouTube, so it's up ready for you guys. I think E&M will be easier for 2022. I have some brand new 2023 questions. I mean to say that I think it will be easier in 2023. They deleted 10 pages. It's got to be easier, right? So I have some new 2023 questions for right now that we're going to do tonight for E&M. Thank you, Nicole, so much for sharing the live. Thank you for the 1,000 likes on the screen here on TikTok. If you're on YouTube, thank you for the thumbs up. You'll be there, Claudia, for the workshop. That's awesome. Y'all will get an email link afterwards so that y'all can watch the replay on Zoom. It'll be on Zoom for about 3 months, and then after that point in time, I'll delete it off of Zoom because I need the memory, and then put it on to YouTube for the YouTube subscribers to have and use. But it'll be there on Zoom for replay for 3 months. Hey, lady, good to see you. Hey, Jill, good to see you. Thank you for the roses. Thank you, Sass, for the roses. Yay. Thank you, BS, for signing up for the workshop. I'm excited for the workshop. Gonna pass my second attempt. That's right. It's already said and done, Sarah. You are gonna pass at the end of January. That's right. Hey, Leah. Yep, our workshop is a Zoom meeting. So are my Friday classes are also Zoom meetings. Those replays are available for 1 week. Thank you for the 2023. That's awesome. Thank you, Go-Kart. Right now, I do tutoring on Tuesdays and Fridays because I have to work like a real job, 40 hours a week. So I have to utilize the other days of the week to do that. Everybody will be back in the office, not this week, but next week. So I'll be more busy next week. Can we tap both screens? Isn't that awesome? I hope so. I have no idea. I don't know much about YouTube streaming, so I know I want to set up things here on YouTube to be able to see. I can see their chat over here when they're talking to me. I need another screen so I can see what YouTubers are seeing. But hey, Vanessa, she's over here. Don't forget about the thumbs. Aw, thanks, Nicole. That's awesome. But yeah, and I can see my microphone, but I can add intros in here to where, like, if the meeting hasn't started yet, but y'all wanted to work on a question like this one right here, it would tell you to go on and work on it and put your answer into chat. When somebody subscribes, it could automatically acknowledge them and stuff like that, so I don't have to pay attention to that kind of stuff so much. But there's a lot of options, I guess, with this OBS that make it more professional. We'll see. Be sure, in case, since I am showing this screen, you know where this page is in your CPT book. Be sure you know where to find it, because there may be some questions on the exam where they ask you what day did they go in effect or what day are they published. So there's 2 different dates there, so that's kind of cool. Kind of neat. Go back to this one. Yeah, this is the question we're worried about. I hope it's easier. Thank you. Oh, Sass got the glitter badge tonight. Did anyone go through AAPC's workshop yesterday? I did. Integrity had one yesterday. A workshop that was really cool. Really nice lady. I'm going to have to put her on my additional educators. She had one. It continues on Saturday, but you have to be in both workshops, and you've got homework to do that you have to scan and get back to her for both days to get your CEUs, but really cool. She talks a lot slower than me, and it sounds really nice, so that you can tell I'm trying to talk a little bit slower tonight, but I'll probably get rid of that in a minute because I can't help myself but to talk fast. But I liked her style of talking. Just finishing billing and coding through the University of Phoenix. Ah, you went through the NHA website. Yeah, the NHA won't let you sit for their exam without taking their course. So crazy, but I hope you liked the course and I hope you learned a lot. The interesting thing about AAPC is you can just buy the exam, and if you pass, then great, you're certified. No course needed. Kind of neat. And that's what I do here. I specialize in teaching you from the exam point of view. How would you pass the exam? Hey, Queen. That's right. It will be your year. We are all going to get everybody past this year. That's right. How do we sign up for the workshop? Let's see. We are going to go to my website. If you're on YouTube, it's medicalcodingbyjen.com. I'm showing that off a little bit. You can do the drop-down menu, and you can go to tutoring and workshops. And when you get there, they're all listed there. One-on-one tutoring is there. I also have the group workshop, which is coming up on the 15th, which is the $12. And then we have our Friday repeats for people who have already got all their notes done, already have everything that they need. Get that up there. And have already tried to take their certification exam, but then they just can't pass. That's what those classes are for Friday. And our last one was really cool. And this one is for our group workshop, which is on Sunday, the 15th, I think it is. Yes, the 15th. And then regular tutoring, of course, is on top, which is just one-on-one. But you just got to go to medicalcodingbyjen.com. Everything's there. Really cool site. Be sure, and if you do join, go to the members only. It's free to join. Utilize that book prep videos or this. Oops, I'm not showing you. Be sure and utilize the CPT book prep page, which is completely free, shows you what notes to make in your books, and the book prep videos, which is free. And then if you look underneath the social media tab, I have the additional educators listed there, but also the social media tab has everything on it that I am linked to. The most important thing is our Discord app, which is really cool. And that little join now is the button that you push to click there. And then my live streams schedule is also there. But anyway, I can show that on YouTube in a direct feed too when I get me a second screen up and I can look at two screens at one time. I do have it already filtered in here. I just am not that good at it yet. I've only done this, I think I did it 3 times yesterday, and I got to get better at this, flipping around and all that stuff, and I will. All right. And you guys can help answer. That's good. That's perfect. Thank you, Champagne. I had champagne for the first time in years when at midnight for New Year's here in Arizona. That was a whole lot of fun. I had some family in town. We had a big old time. That was super fun. We did our New Year's toast. I haven't done that in I can't remember how many years. Decades, probably. Usually I go to bed before midnight, but we stayed up and did it right. I had 2 boxes of fireworks that I had collected over 2 years from 4th of July and all kinds of New Year's when I didn't even stay up late enough. We shot everything off. We just made a mess of our neighborhood, upset all the animals. Poor things. But I don't have any more, so we're done for a few years. Do you recommend getting the study guide or just the practice exams? If you're brand new and do not work in the medical field and know nothing, yeah, a study guide is great because it starts out with the business of medicine. What are the laws? What dates did they go into effect? What's the difference between fraud and abuse and all that stuff that you don't know about if you've never been in the medical field. So that's great. I like the study guide for that. If you can get an older year, I don't care about that because that's great. Because the only thing that's changed really is maybe some CPT codes and then the E&M part. And the E&M part I'll teach you. You still need to know what a new patient is, what's the definition of an established patient, how many years does it has to be before you become a new patient again. All that stuff is in the study guide, and it's in there whether you get the 2018 version or the 2022 version. So it's all helpful. So just get one. If you can find one less than $30, 35, something like that, free shipping or something, do a Google search and switch your search to shopping and find you some from a bookstore that'll ship it to you for free. It's a lot cheaper. And then, yes, you got to have your practice exam questions from AAPC. Do you know how accurate practice tests are through NHA website? I don't, because I don't know. Can you buy the practice exam questions from NHA if you haven't taken a course from them? I know they wouldn't let me purchase an exam attempt without taking their course. So I assumed the whole site was locked. I haven't looked. I will have to research that. I bought all the CCS and CCA practice questions for sure because they allow it, but I didn't know if NHA did. I just subscribed to your YouTube last week and bought some of your notes. Super excited. Thank you, username taken 1.0. Love it. Love your name. Lovin' Gone Me says, hello, Jen. Hello. Good to see you. There was a workshop yesterday from Integrity Coding or something like that. I don't know if there was one from AAPC, but I know there was one from that lady. Well, I don't know. I think it's a whole bunch. It's an LLC, so it's a business. So they have a few teachers. I'm definitely going to pass. That's right. Oh, she put in the wrong date. Yeah, you got to click on the date. Yeah, these are classes for beginners, of course. Absolutely. Everybody's saying B. You ordered your book from Able Books. That's good. That's perfect. We got study material through Phoenix, and they gave us study material and 6 practice tests. That's awesome. Save all those practice tests. And if you are taking a course from anybody, save every chapter review question, anything you get rationale with, every chapter final exam, every chapter review question, save it all. It's all worth saving. What are your thoughts on the Buck step-by-step book? I got it and I let it expire, didn't keep it. I didn't think the questions were in the AAPC format. Some of them, a lot of them are fill in the blank. And then it also doesn't give you the answers to every question, only the odd or evens, which is a lot of wasted time when you don't even have the rationale of how or what the answer is. It would be nice if they put more in the book that was ABCD format, and at least if more of them were ABCD format and then you had answers to every other one, then great. But you end up with a lot of fill in the blanks that you might have the answer to, but not the ones that are the ABC ones. And those are the ones you really need to practice. I didn't like it as much. What I did like was, let's see, is it this one? I'm in a course right now. I liked, this is Vitasource, but what I did like was AHEMA actually has a book out that I really liked that was cool. And it's called the Clinical Workout. Whether you did AAPC certification or you were doing a HEMAS, this book is super cool because they go through the basics of every section all the way through from A to Z of coding. So you might get cardiovascular, E&M, anesthesia, musculoskeletal, and then they do it again all the way through when they go through the intermediate. And then they do it again when they go through the advanced or coding challenges. Sorry, I know my YouTube people can't see what I'm showing off. Let me fix that. Is that full browser? Will that work? Let me see if that works. And let me put that on top. I don't know if that's... Nope. That's not it. Okay. Let me hide that one and let me add another one. Window capture, okay. There it is. Now you YouTubers can see it probably in just a second. Okay. Yes, there you go. So this is the book that I'm talking about. I like this book. Now, you don't get every answer. You get every other answer. But there's enough material. I don't know how many pages are on this. And then they even have super advanced coding challenges. Just 200 pages or so. But I like this book. It's pretty cool. Some of them are still fill in the blank. But there's enough that are ABC that make a difference. And even if we're only getting the answers to every other one, we do get rationale with them instead of just the answer. But some of them are fill in the blanks. I really like this one because it takes your coding skills from basic to intermediate to advanced to overall everything. And I really like it. They did a really good job. This one's cool. I think it's a lot better than Bucks. But yes, I did have Bucks too. I just wasn't impressed with it, didn't play with it, and didn't keep the book when it came up to being expired. Like, it'll be here in one of my expired books. Yeah, I didn't like it. But I do have the new evaluation and management course up. Started January 1st yesterday from AAPC. Been working in that, which is kind of cool. Be sure and whatever is in your grades or anything that is in your chapters that has practice exam questions and stuff, be sure and save all those because you can enter those into your notes. And I don't know if that's showing off on, that's not showing. Oh, it is showing off on YouTube. Great. Perfect. And then the other thing would be for, wrong one. That's the YouTubers. This one. Will it show this one to the YouTubers? Yes, it does. That's cool. Okay. This one we can go to. No. Medical coding with Jen. Yeah, we can go there. I can show that off to YouTubers. So the tutoring workshops are all located there under tutoring. The one for the 15th is right there for the 12, and then Fridays is over there on the end. For the ones that are not newbies, already have all their notes done, have already done all those practice exam questions multiple times, just take your exam, you still can't pass. And this is kind of like a deep dive Friday. Yes, you do get a replay if you can't attend at that time when it's live. The point of this is to watch the replay. You're going to hit pause every time you see a question or an answer. You're going to work out the question by yourself and then hit play and see if you got the right answer, and then make notes and hear about my rationale and what I'm saying needs to happen with these questions when you're doing them live. But hopefully that will all help. And don't forget, for anybody that's new, to be sure and go to that CPT book prep page. It's completely free. You click on a picture. It gives you the instructions on how to book prep your book, have some videos even on it, and then our social media links. Be sure and please join our study group, which is free and very cool. You need to download the Discord app and then come back and click that join now. When you do, magical things will happen and you'll end up in our 100% free study group. All right, let me get back to our practice questions and get this show started. Let me figure out how do I do that? I think I'm gonna hide that one. Does that make it go back to? Nope. Oh, yeah, I gotta hide that one. There we go. Now we're back to questions and books for YouTube. And what did we say this answer was for this one? It is B. Two, by the way. B is correct. E and M. Can I bring this quiz over? And does that one show on YouTube yet? Or do I have to do something else? Okay, I have to do something else. Let me get this one. Okay. We're going to hide that one. Going to hide that one? No, we're going to give that one. Ebook we're going to hide. Be right back. We hide. Word 2 is what I want to show. There we go. Yay! I'm figuring this stuff out. I'm trying. All right. Oh, and I forgot to check what YouTube was saying. Y'all are all over here chatting away, and I forgot. Let's see. Christy B. This is cool, Jen. Thank you. Queen says hi. Daisy. I'm just reading off the chats over here on the side. They'll be farther than y'all can see on TikTok. Daisy says, I'm so glad to catch your live. What's this, your top for today? Topic will be E&M 2023. I have some new questions I want to show y'all. Do you recommend me getting a new 2023 book or stay in my 2022? Unless, Nancy, you got money to blow, then no, stay in your 2022. I have a document on my website at The Medical Coding by Jen. It's $20, somewhere around there. It'll show you how to change your 2022 book into a 2023. The major area, of course, is E&M, but you get to delete 10 pages of code, so it's not like you're updating a bunch of them. And then you're going to need to update some times. Instead of them being 70 minutes, they might be 60 minutes or vice versa. That's not big of a deal on some E&M ones. And then there's a hernia section where they deleted a lot of the codes, and we'll have to add in some new codes for the hernia. But I show you page by page on what to fix and exactly what it looks like typed versus my hand printing and all that stuff. So it's super cool. Save you some money. Can I purchase your 2022 notes for my 2023 CPT book? You can, but my 2023 notes are even better than my 2022 notes. And you can buy the 2023 notes for your 2022 books, which will also show you which codes are new, and you can add those into your book, and then it kills two birds with one stone too, but they're always better. Every year they're always better. All right, yes. So the first thing I had up here to show you guys was just definitions of the SOAP thing. That's all. Be sure you know what the definitions of subjective, objective, assessment, and plan. That's all. Just write those in your book somewhere, anywhere. I usually write that stuff in the very front before we do E&M. And in fact, I can probably show you where I did put it. I think I put it over here on the very first page of our green. I did. I just got to flip my page. Let's see what we're showing those YouTubers. They're going to get the book view while they're getting the, so that's where I put that in. Whoops, wrong one. We're going to that one. But anyway, let's get to a practice question for E&M. All right. I put these big blue boxes over it so you can't see the question, because if I'm going to be displaying the screen on YouTube, remember I was using that black 3D printed thing over the top of the screen, and I can't do that if I'm going to be in this mode. So now I'm just going to have the blue that I can move around when I get done. So it makes it cleaner, and then that camera won't be going in and out either as I'm putting stuff over the top of the screen. So the first question is just deciding on your patient status. Are they in the office? And if they are in the office, are they new or established? If they're in the hospital, are they admit or are they consultation? So that's all I'm thinking about when I think about this question and see my answers first. All right, I'm going to move my blue out of the way. Y'all can see the question. Remember to read from the bottom up. If you're going to read anything, we're looking to code what Dr. Wolf said or did, what Dr. Wolf did. So Dr. Wolf is seeing the patient today for the first time in the office after seeing the patient in the hospital. What would we code this patient for today? Thank you for sharing the live. We have 9 lives on TikTok and 3,000 likes. Y'all are awesome. And we're 4 away from the TikTok subscriptions to meeting the next goal, which we will have some prizes to give away when we meet that new goal. I have some new patients. Yep, if they've never been to your practice before, in the office, you're going to hand them the new patient paperwork, right? But they were seen by your physician in the hospital a week or 2 ago. So technically, they are established patients, which is crazy insane. That is a D, guys. So that is one scenario that I don't actually have under my established, I don't think, for this year. So if I was to go over here and look at my E&M codes for, I can't tell, let me go back over here. See, I need another screen so I can tell what I'm showing you guys. So if I was going to be over here in my book, I have some little scenarios that I write in here. And let me show you TikTok, guys. That I put down, like a stable chronic illness, comprehensive, but I don't have anything mentioning a hospital follow-up to establish care. How would we write that? How would we write that? New patient in the office. How would I make it clear to you guys that if we did do, in fact, I would probably write it right here next to the header of established patient. I would put something here to make note of this question. Let's see. Example. Hospital. Patient comes to office to establish care equals established patient. Maybe I shouldn't have put established care, but something like that to tell us, I know I went away from the camera, to tell us that this patient was new to the clinic, but, ooh, it's still blurry. Come on, stop being blurry. To tell us that we have a hospital patient comes to the office to establish care. That is still an established patient. They would not be a new patient. Even though you're going to hand them out the new patient paperwork to fill out, it's going to feel like they're going to be a new patient. But during the exam, in case you get a question like this, that is what the answer is that they're going to be looking for sure. Whoops, sorry guys. Does that make sense? First time in the office and follow up on the hospital. Shug, you got it down a whole lot better than I did. That makes more sense, for sure. I can't tell how many we got on YouTube. All right. Let's go back to our next question. Let's try number 2. There's some rationale for you too, in case you wanted the fancy makeup of it. Oh, I do have it up on YouTube on my phone. We have 19 people on YouTube. Woohoo! And 50 on TikTok. So that's cool. That's cool, 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 cool. All right, our next question is going to be preventative established patient, office visit new patient established, or preventative new patient. So obviously we probably have a well child check, and we just need to know whether they are new or established, probably. Read from the bottom, see what's going on. They want us, what category did we do for Dr. Smith? What keywords do we see? Comes back into, then that means established, no matter what, right? So I'd get rid of both new patients based off that wording. Then it's just to see, did they do and accomplish that wellness exam? Yep. If we did, then we're A. Yep. Good job, love lady. Good job, Claudia. Our answer is A. All right. Try not to make too much noise. I'm going to let you guys think about what you think this one is. We've got emergency room department, initial hospital care observation, or office visit. And yes, we are talking about 2023 guidelines. So throw your 1995 and 1997 and your 2021 guidelines out the door. We are talking only 2023, and it's okay if you have the 2022 book and don't know what the 2023 guidelines are. We will write them in, and we'll do that after this question. I'm going to let y'all look at it, and then y'all tell me in chat, whether you're on YouTube or on TikTok, what you think the answer is. see if I can find anything around emergency room. Let's see. So if you're in the 2023 book, you might be around page 15. If you're looking for your guidelines, so I'm just showing them a little bit of that kind of stuff. Page 20. Page 20 might have some stuff in it too. Yep. This beginning of it starts whether you're inpatient hospital or observation care services on page 15. Then the emergency room department guidelines are on page 20. Yes, absolutely. Perfect. Everybody's saying A. Everybody's got it wrong, my loves. It is not A. I'm just teasing. I'm teasing. Y'all got it right. It is A. So we're just doing presents for an emergency room cough. And how are we going to bill it? It's just a cough. That's all there is. Very good. Perfect. Here's another one for a regular office visit. New patient versus established. Preventative again. Let me get this one. And we'll Gucci. Make sure their other screen should be working good. Be sure and check the bottom answer, subcategory. This patient just moved, comes into the office to establish care for hypertension. Those are key terms that you can put beside the correct answer. Like this one said emergency room department. What did they use? Nothing, they just said emergency department. Yeah. There wasn't anything fancy in here other than calling it emergency department. But this one, just moved, indicates new patient, right? And we know it's not preventative because they had I guess you'd call this a chief complaint. Patient's diabetes is uncontrolled. She needed refills of her meds and wanted them changed and all that stuff. So lots of complaints in there. So we know it's not preventative. That's what I would be thinking. And yeah, A is correct. Good job. Emergency department. We've got initial hospital or observation, emergency, and hospital inpatient. Again, we're dealing with the 2023 guidelines, which are going to be on page 15 and 20 of the 2023 CPT book. Ignore, ignore, ignore. So check your bottom answer. We're looking for Dr. Thomas. What is Dr. Thomas going to bill? This one's different. Refill meds, yep. That would be moderate too. Refill meds, medicine reconciliation. The cool thing about the 2023 guidelines is, you know how last year, if we didn't write a prescription, we knew it was like a 12. We just gave you over-the-counter meds, like 992, 12 or whatever, or 202, a level 2 visit. Well, if they thought about writing an antibiotic, but then decided against it, they can still bill it as if they wrote it. So that's new and interesting. But they have to document that they thought about writing a prescription and then thought about not doing it for whatever reason, and document those reasons. If they document that they thought about writing a prescription, then they can bill for the 13 for the, a 7-day prescription, even though they didn't write it. So it's kind of interesting. We got B's and C's. The patient's being moved from the, who is the ER doctor? Who's the ER doctor? So Dr. Thomas is the ER doctor. And that doctor admits the patient to observation. But in the 2023 guidelines, are we able to bill for the emergency room visit also and the observation admit code? Do we get to bill for both? Yes, Mandy. Mandy says she has a note saying that don't code office visit with hospital, but is that the same as an ER visit for the observation? Observation placed only can be billed observation code only. TicTok Tia has it correct. I love all the debate going on. Let me see what the debate is on YouTube. What do you guys think? Can we bill ER and observation admit codes? Get over here to page 20. What do our 2023 guidelines say? Try again, Angel and Daisy on YouTube. We actually are. We are going to. So the guidelines indicate that the patient is admitted to the hospital in the course of an encounter in another site of service. So both services can be reported. The guidelines did change quite a bit. So let's write this example in near our emergency room visits for this one. So right here, if we've got example, patient eval, ER, then admit, OBS, same doctor, same MD, code, ER, visit, and admit. You know, I don't like the word initial because it confuses people. So admit hospital, because observation and admitting to the hospital are now the same thing. They're the same thing. It doesn't matter whether you're being admitted and discharged on the same day or what. It's still, they're all the same now. Admit. What did they call it? They called it hospital. / OBS, which means bill both. Does that totally confuse you guys now? Does that totally confuse you guys? So that's what I put in the book. Sorry. I don't know if I can get a big enough view to get it all into one, but I just wrote it across the top of the emergency room visit. Something like that. I have not posted the 2023 E&M notes on my website yet. I'm still, as you can see, updating them right now. I was waiting for yesterday to happen so that I could have more practice exam questions with direct rationale come out so that I knew how to update the notes according to what the guidelines say. The guidelines tell us this kind of stuff, but coming up with rational explanations of what an example might look like, a little difficult for me to do with everything else that's going on my own. So it was nice to see somebody else come out with these rationales and clinical examples. So now that I can fill up the book and get these done, I have all the rest, of course, done as far as my notes, marking them high, moderate, low. I've already put in other examples of what they're going to look like because our first ER visit is just a nurse only. We don't need a doctor to be there. And now they've changed them to where last year we had 2 of them that were moderate. We've gotten rid of that now. So that's super handy dandy. So I was just waiting on these to come out. Now that I've got some new practice exam questions, I'm real close. Should be able to have this out by Friday and posted for you guys. So it's just waiting on some new material to come out. You do not have to buy a new CPT book. We can get all this into your 2022. Absolutely, we can get it in your 2022 book. I've already got those notes out, how to change it, how to get rid of the ones that you can delete, how to update the ones that need to be updated because all these times and stuff changed. It's not too bad. We just changed this one into a nurse visit, and then this one is not. Before it was straightforward. Now straightforward moves down to the 2. And then our low changes to the 3, which matches up now with the low that we have in E&M as far as the office visits. So it makes more sense that the ER visit with the 03 is low. So it makes more sense for sure. This is my class, Sonia. I give my classes out for free. I teach 3 days a week. Free on YouTube and TikTok now. And this is my class. I like to teach for free. I don't charge for classes unless we're doing workshops, and those are $5 and $10. So this is my class, I guess, until I quit my job and make a class. But still, I don't know what I would do or how to even begin to make a class. Good gracious, no idea. But you don't see this guideline? Let's see. Let's see. There's no distinction between new patient. Yeah, I wish they'd give me page numbers. Like, where's the guideline for this? Distinction between that and OBS, ALS observations, two-way communications, treatment rendering, inpatient. Yep. Nope, that's all unhelpful. Where is our observations? That's with our admits. So that's our 221s. Let's go back to those. I bet our guideline is going to be right before all this, or right near all this. Our hospital inpatient services. Let's see, observation, patients admitted and discharged on the same day. Encounters on the same day. Yeah, that's our combo codes. That's our combo codes. Those are still there. Where's our admit? Yeah. We're going to be right over here. When a patient is admitted, yeah, it's going to be right there on page 15. Your guideline's going to be this. That's why I got every word underlined right here. We're of course going to need that modifier 25. This question doesn't have a modifier on it at all, but both of them would be billed, and you would definitely, if you're moving from one department to another department in the hospital, from the hospital emergency room department to the office to the nursing facility, it's got it all written right there. Right there. Plus, there it is written in our rationale. Dr. Thomas performed his initial ER visit. Did he have all that stuff? Dr. admits the patient. He sees the patient in the emergency room and then admits the patient for observation. And it's so cool. We don't have to have the history or the physical exam anymore, and they still get to bill all that. They've gotten rid of all that. Just really technically needed our MDM, which we don't have, but they didn't ask us what level to bill. They'd only asked us what subcategory to bill. And then we would need our MDM for this one too. Thank you for the 5,000 likes on TikTok too, by the way, and the 10 shares. I do tutoring. Indeed. I have a website, medicalcodingbyjen.com. Be sure and go there. All my tutoring and workshops are there. Free advice on how to book prep and our study group. You really want to join our study group, which is on Discord. You'll download the Discord app, go to my website at medicalcodingbyjen.com, click on the join now, and then you've got access to all my free stuff inside all of Discord. We've got a main chat room, then we've got practice exam question rooms, what to expect on exam day, E&M resources, which will all be updated and changed too, CPT book prep, ICD-10, you name it, compliance, other certification practice exam question rooms, midterm anatomy, job resources, you name it, it's all there. This is where you get lots of help from. Really want to join there. All right, let's try another question. Make sure YouTube is showing off like it's supposed to. I think it is, because I can see it right down here. Yep, there we go. Let's switch to another question. All right, are we going to be... Oh, yeah. So you remember when I told you to take the notes for what's subjective, objective, plan, assessment? So these questions are what part of the note goes in each category. So here's your first one. What do you think? Yes, MK, we can do this for Friday. I'm still learning too, guys. So as they change, you know, I can read the guidelines all day long, but until I see it in practice with practice exam questions like this, then, you know, it's hard to put it in practice. But that's why I knew there was going to be a lot of changes. That's why I got the whole E&M course, so that I could do that and be able to teach you guys too. So if we go, there's my website. But yeah, I bought that course for the comprehensive evaluation and management course. It's different from like CPC. This is just 10 chapters of all the new, or 12 chapters of all the new E&M crap. So I'm slowly getting through it. I'm on chapter 4 right now. So I just started today. So I did 4 chapters today. That ain't too bad. This one right here is our answer is D. Good job. Good job. And good job on YouTube. Victoria, Daisy, Siobhan. Yes. Good job. These will be easy. Which one of these? Cardiovascular, tummy, and skin, and respiratory would be described in this scenario. Okay, go-kart, you got it. The hard part is just letting go of what you've already learned and remembering the new stuff. When they say rails, clear bilaterally, yes, we are talking about respiratory. Good job. One more like this, I think. When they talk about your BS, what category do you go into? Rails. Yeah, it's hard to let go of past learned material. And that will be the challenge in the next few weeks, for sure. We will get there. This makes much more sense, I promise. But we will get there. I'll help you out, guys. We got D again? Yes, we got D. Good job. Another one. Dysuria, where does that go? Objective, plan, assessment, or subjective? Because this is the patient is stating stuff. So it's not the doctor. This is questions the patient asks the... You got any blood in your stool? Blood in your urine? All that kind of stuff. Where does that go? I don't think anybody's getting it correct. Wait a minute. Okay. Yeah, I've seen some correct ones now. Jen got it right. Yep. Braun, yes, it is subjective. Good job. Yep. Patient statements always go in the subjective. So think about that. Patient statements. That's something I could write at the top of I just wrote like the words, what does S mean, subjective. I need to write and add patient statements next to it, and that would add that. Add some more details to that note. All right. Whatever's listed underneath the blue box is either details of the physical exam, patient's account of the illness or condition, or diagnosis of the treatment or reason for the visit. What would this stuff go under? Good job, Siobhan, Crystal, Samantha. Good job. You need those notes. You got it, love. I'm coming. I promise. Just need a couple of more days to finish them. It's good that I don't have a lot of work to do. Everybody saying C? Yes, it is C. Good job. That is your known as diagnosis, which is, their treatment, their plan, their assessment. That is their diagnosis. Yes. C. Miss Green. Let's see. A, details of the physical exam. When they say the assessment and plan, then they mean the diagnosis and treatment. Yep. It gets crazy thinking about it when you haven't looked at it. It seems like it could go in both areas for sure. All right. Are we going to be, I don't know why. Are we going to be a nurse visit, a level 2, level 3, or level 4 visit based off the scenario here? It goes kind of long. It's a little bit of a case, but we are still thinking about 2023 guidelines. We probably might not have any MDM in this or time, so we're going to have to think about right out of the gate how many tests were reviewed, how many tests were ordered, what was the patient's diagnosis, and come up with our visit. That's where that chart on page, hey Lester, page 8 comes in handy, which I still got to finish 100% completely. I did the high and the moderate, but I don't have the low done yet. What level visit would a tibia fracture go under? And they did say they ordered another x-ray. And it looks like there was some review of old x-rays. What do you think we would be? Everybody saying C? We're going to be level 3. There's no prescription written. Yep. 3 is correct. Good job. We got a low level left fracture, uncomplicated problem. The number of complexities, we did an x-ray, was performed. The risk of complications or comorbidity, was low, so we get to keep our 13. All right, let's try this one. I don't know why they have the O one there. I'm sitting here looking at my chart. But this was just a copy paste straight from the course, and why they're giving us this code, I have no idea, when it's still not in the section. But this was my chapter 3 exam on that E&M course. It's okay. Oh, it's trash can night. So we got right knee pain, 70-year-old, no MD and no time. What did we order? Anything? Oh, there was a decision for surgery. Maybe. Discuss treatment options like joint lubrication, supplements. And remember, I told you earlier that now, even if they consider writing a prescription or consider doing a procedure, they get credit for it even if they don't do it. So that decision making is much more hyper-focused in the guidelines this year than ever before. If they document that they decided not to do something, they still get credit for it. It's just a knee, though. It's not like it's major. They didn't write any antibiotics. They didn't do anything. Reported at our office. It's like you're 70. Go get you a new knee. We are a C. Good job, butterfly. Good job. If I get the answers correct, I don't end up with a rationale. So I'm going to have to start getting every question wrong so that I can get the rationale. Be a complete failure on this course. All right, another one for another visit. We got lupus. Looks like she's just got the 1-month follow-up, no new complications, non-tender. Where would we put lupus? For our 2020 3 guidelines. No scheduled follow-up. Return PRN. You gonna give them their circling the drain and dying? Level 15? Level 5? When they have no scheduled follow-up and they don't have to come back ever? And apparently they're not on any meds, or they would be getting refills. What does it mean when a patient comes to you, they get seen for something, and they never have to follow up again? Is it a chronic condition? There you go, Miss G. It's just a self-limiting problem, which turns it into a 12. If they did not get any prescriptions, you told them, come back if you ever feel like it, then they're just a self-limiting problem. You'd think lupus is a chronic condition that needs to be managed or whatever, just because it says lupus. But we're not billing off of a diagnosis. What we're billing is the doctor's decision making, the plan for follow-up, and the risk. Now, is there an increased risk for not taking care of this patient and doing some lab work every 6 months or something for their lupus? Probably. But since we didn't do any blood work, there's no risk from a needle poke. Oh, my Lord, my child. You cannot borrow my Rolly brush. You got somewhere to go? Somebody to see? You got to look fancy too? You can run around the house with cat hair on you. Just fine and dandy. Goodbye, my love. Shut the door on the way out. And return it when you get done with it. Sorry, my child walked in. Okay. So we got no needle pokes, no risk. We sent them home with, come back if you ever need me. So that's a super, super low level. Remember, bill what you did, not what you think you should be billing off of. I got that one right too. I was trying to get it wrong so I get the rationale. I got to do better. All right. We got consultations. Consultations? Yep. No follow-up, no risk. No blood draws, no EKGs, no nothing, no risk. Yep. It's crazy. Thank you for the 5,000 likes and the 10 shares. Love it. How you guys on YouTube doing? Crystal and Jay and Samantha and Rachel, they're all working away. JJ, I see you in there too. There's 33 on YouTube. Yay. I hope this view is better, except for the shadow I have from my soda drink. Well, water bottle. All right. What level visit would we do this? Is this a consultation? We have a heart murmur, cardiologist consult. Do we have an MDM? No, we got a history and exam listed. Follow up, do an echo and an EKG. And note back to the practitioner. Probably. Hey, April. Good to see you. Got nobody answering this question? We've got 2 unique tests done. Where does 2 unique tests throw you? Level-wise. If it's 2 unique tests, then you're at a level like our book. So if you're using this lovely little chart thing, the middle right here, 2 unique tests, we're in our limited, which is low. Here, if we did 3 unique tests, we would be in moderate. So that's your big difference. The echo is like an ultrasound of the heart, EKG. Now, if it ordered like lab work, blood work or something, that would have been 3. We could have billed a moderate and moved it up to a 4-4, but since they only ordered 2, yep, I like B too. Yep, B is right. All right. We've got new patient, hospital or admit hospital, I guess I should say, or subsequent hospital, I think, is the 3 codes. Be sure and look up your differences between all the answers first. Know what your differences are before you look at your question. Whoops, I'm trying to write underneath here. But I think they're subsequent and initial admit hospital. The note does say subsequent. Who are we billing for? We're billing for a cardiologist. And atrial fib. Did they order anything? INRs. Second day. Yes, my Travis. What do you want, my love? You want a cookie is what you want. They're right behind you. You've been eating them. What do you want? You did not come in here to pet Lester. What would we be billing for this scenario if we saw this hospital note? Try to get it all onto one screen. A little difficult. Let me move this up. See if that helps. There we go. No, not while I'm on the phone. No. No. When I get done. Good night, Samantha. See you later. The replay will be available for you. So, no, we're doing 2023 from here on out. We are on 2023 guidelines because the exam, if you are taking any exams in medical coding, well, as far as AAP is concerned, then you're going to be in the 2023 guidelines. CCS and CCA get to stay in the 2022 guidelines until June, May, June. They keep their tests the same. So, number one thing, my loves, is just because the note says it's subsequent doesn't mean it is subsequent. You don't bill what you're being told. You bill what was done. What was done. The gastroenterologist admitted the patient, right? But who are you billing for? Who did they say down here? You're billing for a cardiologist. So, is this the second time the cardiologist is seeing the patient? The cardiologist sees the patient for the first time. Cardiologist does their own exam. Miss G, Lady Love, yes, pay attention to those fine details. Who did they ask you to bill? Don't assume. Who admitted the patient? A different doctor. The replays are available on YouTube. It's actually playing right now on YouTube too. And The YouTube is medicalcodingbyjen.com. Did you say the exam will stay the same as 2022 or does it change to 2023? Daisy, to answer your question from YouTube, if you are taking a HEMA's exam for CCS and CCA, they do not change their exam according to one thing that I read on the internet. I don't know if it's true or 100%, but I hear that they don't change their exam until mid-year. So AHEMA people get to use the 2022 guidelines for a little bit longer. AAPC, on the other side, has already switched their exams. Nobody's taken their exams until the first 2 weeks of January are over with. I think the 16th is the first day they're going to take the new exams. And according to them, they are already going to be switched into the 2023 yearbooks and using those guidelines. What did it say? I can never make it through the whole live. Oh, I'm sorry, Wander. But yes, the replays are available on my YouTube. The link to those are on my website, medicalcodingbyjen.com. Just click on the social media tab. It's right there. So then you got to decide, are you billing a 221 for the cardiologist or a 222? Because we're not subsequent anything for this cardiologist, and our only other options are admit patients. Did we meet the criteria to bill for a level 2 or a level 1? We didn't order anything. Did we? Did we order anything? Wait a minute. Did we order the echo? Did we do anything? Patient has their INRs to follow up outpatient. Performs an exam. There's no time listed or anything. One chronic condition with no significant symptoms. Would you bill that a level 2 or a level 1? Yeah, no times listed. Yes, it is the 2-1. So even though the note was labeled subsequent hospital visit, however, the cardiologist is seeing the patient for the first time. So this is an initial hospital visit. Isn't that crazy? And the number of complexities and problems that were addressed at the visit is one stable, chronic, low condition. There was nothing reviewed or analyzed, not a thing. Coumadin therapy is the only thing that could be of risk, and it can kill somebody, so they have to manage that. But other than that, there wasn't anything. They didn't even mention drawing any blood or doing anything else. So they gave them a straightforward for this one. According to the new guidelines, isn't that crazy? I would have thought, well, isn't it a cardiology, like a consult or something? But no, they got rid of all that mess. Totally different now. I've still got to do some more questions from the course, of course, and get more E&M codes, and I will get some more E&M codes from there. Let me switch this. That's all I've got of the new codes from the course so far today, but I have some more questions prepped for the last 20 minutes here. Let me make sure I switch it over for our YouTubers. Let's see, we're gonna open up that one. That's, I think is that the right Word document? Let's see. This one, yeah, but it's supposed to look different, right? Or is this gonna be a new one? A new Word. I only have 2 Word documents open. I never know. Yep, that's what it looks like now. Yep, that's good. Now the YouTubers can see that. My book is all crooked. Crooked. All right, let's get back over here. And yes, you are right. If you look up those codes in the back of the book, that's for infusion. So that is pre-packed fluids and electrolytes. Very good, MK. Very good. All right. What about these codes? Back to our old routine. What I would be doing is running to the 401, 402, and probably, you know, right there, the 401. Let's go see. 964. 964. 401. It's so strange to see a book that doesn't have anything written on it. But what is our differences in these? Let me check and see what OBS looks like now. All right. So for these codes, what's our one-word differences? One's non-hormonal, this one's hormonal, and then our 05 is intralesional, where the other ones are subcutaneous and intramuscular. So hormonal or non-hormonal is probably what our answer is going to be about. Let me grab that and move. We are hormonal, so probably 2, right? Because that's our only hormonal one. Super easy when you do them that way. Just go see what your difference is. And even with a blank book, a book that isn't even marked up, you can go see what your differences are pretty quick. That's my TicTok right there. In the question, we just had to go look in the book and read what the differences were. All right. All right, this one. Which 2 codes or 2 answers would you keep with this one? I got my thing is fun all up in the way. Let me stickers. Move you out of the way. There we go. Yep, I like C and D too. I would go to my 93075, see what my difference is, see if there's anything maybe I need to know about it. Probably not. What's our 963? 963 is going to be backwards. 963. The other cool thing is that, guys, I can start showing on YouTube too. You see where I had that page up with the VitaSource? I can share instead of having to see me shake the camera around and stuff. Once I find, has anybody else got their electronic version of the 2023 CPT book from AAPC? I don't have mine yet, but I have the book. Why don't I have my electronic version? But I don't. But anyway, I don't know if anybody else has access to their electronic version, but the cool thing is I can show the electronic version of the book instead of my paperback book, just because it won't be all blurry or my handwriting be all up in the way. It's just I got to get fast at finding the codes in the electronic version is the only thing. So if I'm in the medicine section, how the heck? I don't need to go there. I need to go here. Do you go find your codes really quickly in the electronic version? Because in my OBS version, I've got ebook right there that I turn on, and I think that will ebook on top. There we go. See how I can show the ebook with the question, and boy, how super clear that is. But I got to figure out, how do I go find the codes quickly? How do I go find them quickly? Because they're all over the place. So right now I'm looking at, what codes was it? 90375. Is there, I wonder if I can do it that way. Search 90375, enter. Yeah, take me to that code. But I gotta get out of my search. 0375. And then I need to go to OBS. Yep, my page done changed. Put the table of contents in there, and there we go. That'll make it look better. Now it's there. Now I can see the question and the book pages at the same time. 90375 is rabies. 72. Yeah, I'm looking for 72. Is there such a thing? I can't do it on, yeah, I need the 96372 versus the 90473. So anyway, I can do something cool maybe one of these days if I can ever figure all this mess out. But I can share the electronic version of the book. And the cool thing about it is I can, if I'm in the book, I can highlight things, show you, you need to highlight that word. Only this word is the only one that's different. I don't know. Eventually we'll be able to make notes in here, just like we do in our paper books, that will show up in our electronic books, that will transfer from one book year to the next book year without updating them again, I think, one of these days. And then if I wanted to bookmark, highlight, make comments of some sort, I think I can, but I got to figure out how to do all that inside this book and be able to show you guys, and also be able to delete what you don't want. So just got to figure it all out. One of these days I will. And then the YouTube people, what they're getting is a version of the book with the questions side by side without any blurriness. They're getting a really good camera view compared to what my TikTokers are with the shaky camera and stuff. But at least your replays will be kind of really cool, I think. Anyway, let's go back to this and figure out what our question is. I know. Let me turn off that other camera. So we don't need that. I need to go back to which one was it? There it is. Okay. Which answer is appropriate for rabies? ER, sorry. It's a bad time to hop in when it's totally new, but yeah. How do you get the electronic version of the book? It is by purchase. So when I went through AAPC's website and I purchased the books, I purchased the e-version of all the books too. So I had, if I go to my AAPC and I go to my AAPC, go to my purchase history here, and I go to my items that I purchased. Now let's go to my receipts. I go to like June 2nd, I think it is, right there. Yeah, this receipt, when it pops up, eventually. I gotta call them tomorrow. They weren't open today for me to ask. Like, what's the heck's going on? Where is my electronic version? I even have the electronic version of the HipPix, which hasn't even been shipped out yet. But I bought all the books with the ebook and print, both. So I'm just waiting on those things to show up. So far I've got the CPT and the ICD-10 here, but I don't have the HipPix here. But then I also don't have the electronic version of the 2023 version of the CPT book. But to be able to navigate all this will be fun one of these days. Just trying to learn it all and make sure we get a good view for you guys, no matter whether you're on YouTube or on TikTok. Oh, it's all right, Jen. All right, what do you think right here? Thanks, Becoming. Y'all are going for C? C is correct. Good job. All right, what do you think about the 934s? I see we've got two with the same answer. And then one of them's just wanting to know, do we have two codes or not? So I'd run to that 5-1 code, see what's going on with it. 934. 934. Where are we at? 934. And the cool thing about the YouTube, I won't have to download the TikTok videos anymore, then upload them and label them. They will already be labeled and uploaded and all that good stuff as soon as I end the stream. 3-4. Where is 3-4? 3-4-5-1. Three, 4, 5, 1. And then our 3, 4, 5, 5. Is an add-on code, so you can't really do that until you go see what Mama is about, which is the 3-4. So be sure and check out your mama code to that 55 to see if you're going to add it before you worry about that. Nothing I could do about it. It's already showed. I'll have to trim the video, hopefully, and get it to where it's shorter. But I do it all the time, even though I get warned all the time. Stop it. I have a P.O. box listed on my website. But everything is Googleable now. I wonder why TicTok is having a hard time connecting. Looked like it was having a hard time. Did you do the right heart cath? Fruity Booty Cupcakes. You really miss coding now? I miss it too. I know, yeah, my Wi-Fi, I think it was going in and out. It's a little weird. So would we add this or not? All we did was the right heart catheterization, and all we did was measure for oxygen saturation. Would that take 2 procedures or 1? Hey, Holly. Yeah, just the 1. Perfect. Modifier. Let's see about this modifier. Are we going to assign a 74, 52, or nothing, or only anesthesia? And let's check out our last sentence to make sure what we think we're coding. So how would the hospital bill the coding? We had to cancel a procedure. At what point did we cancel it? What had we already done to the patient? I haven't checked. Let's check as soon as we get done with this question. We'll go check and see if they changed. I checked them the 31st or something like that, but I didn't check them after the 1st because I was playing in the course today. So this one is A. We are going to assign the A because of that anesthesia. Yep. So let's go check. Let's see. Purchased exams. Purchased items again. Let's go to items. Let's go check exam A. Let's go see. No, they haven't changed yet. Everything still says completed. I've already done them. Yeah, they haven't changed. Let's see. Let's look at D. B, D, B, E. They're all still the same. Come on, open up. Internet's running really slow right now. Yep, it says completed. I don't think they've changed. If they were new, it would say incomplete. But I bet these are all the same. All right. Let's go look at the E&M ones real quick, because those are the ones that changed. We got our ERs, those are all the same. 65-second opinion. Who wants his own second opinion? He's going to be a new patient. That one hasn't changed. This one with the time hasn't changed. It's always going to be this one because we don't add that to those. Yeah, that was crappy. We only had 2 E&M questions for this whole section. Yeah, those haven't changed at all. Let's see. Let's try C. See if there's some more E&Ms on this one. Like I said, they're not releasing any new exams. Like you can't take any till like the second week in January, so maybe their new questions won't come out till then, but the course seems to have some new questions, but I don't know. And they wouldn't let us in it till January 1st. I don't know. How about this one? Let's see, is that our same one? Atrial fib. Yep, atrial fib is that one. New, if it's new, is it a new patient? Follow-up, no, it's established. So it's that one. Same question. Knees, where do you put your knees? Flare up. They did give a prescription. We'll do that one. And then critical care, total time was 30 minutes. Critical care infant. And we don't do any 8,000s. Those haven't changed at all. Those are all the same. New patient. Yeah, they're all the same. None of them have changed. Sorry, guys. They haven't changed at all. They don't have any new ones out yet, Jen. So hold out. Wait until they update. Because you want to get the most updated ones and you want to get them to last the longest. That way maybe you'll get a little bit of the new ones for the next time they change anything up. So just wait. They haven't changed at all yet. So I'll let you know just as soon as they do. All right, guys. Well, I hope this was handy dandy. Yep. I'm going to need a second monitor so bad. I tried really hard to set one up. I have 2 laptops, and I tried to Bluetooth them and set that up to 2 screens, and I just ran out of time before I figured it out. And then I have 2 the HDMI cables, but you can't do HDMI direct from one laptop to another. You need a converter for one to be in and one for it to be out. I ordered that. It'll be here. It's probably outside right now. So it'll probably, I had somebody deliver it, so it's probably outside right now, which I could do that. But I'll have I'll have the second monitor up for Wednesday's live for sure, so that way I won't have to be looking at OBS the whole time, back and forth. I tried to have YouTube up on my cell phone so I could look at it too at the same time, but YouTube is better than TikTok. Look at you guys. But I can't tell what I'm doing, but it looks like it's spiraling. Oh no, cool too. OBS is disconnecting. What's going on? Anyway, let me end this live on OBS anyway, and then